My name is Catherine Wark and I'm an applications scientist working with BMG Lab Tech for the UK division. I'm very lucky to be joined today for this SLAS workshop by Professor Stephen Charlton. Stephen has a vast experience from his time at Novartis, but he's now heading up Accelerate Bio and also is a professor at the University of Nottingham. Also from the UK. So today, together, we're going to be introducing to you the use of tag light HRF probes for the measurement of kinetic interactions. Before I pass over to Stephen, who is the person everybody's here to really talk about his work with fragment screening in this area, I'd like to just talk a bit about the Ferrostar FSX that is used by Stephen and his team in their labs, and some of the features that really make the Ferrostar applicable for this kind of kinetic monitoring using TR-FRET applications. So a lot of people here will perhaps already have a Ferrostar FS in their laboratory, even if you do not have our Ferrostar FSX product. Both of them are compatible with measuring TR-FRET and with measuring TR-FRET kinetically. The Ferrostar came out in 2009 with a real emphasis on speed and sensitivity, being able to measure all plate formats up to even a 3, 4, 5, 6, 12 format. It has dedicated read technologies for all applications from TR-FRET to alpha, so we ensure the best performance. And we can guarantee things like speed with our simultaneous dual emission options, which are particularly important for TR-FRET applications, for example, or BRET, where you have one excitation and 2 emissions. So they're read simultaneously using the Ferrostar product. And the Ferrostar utilizes a optic module design. So basically, all of your filters and dichroic mirrors are in handy barcoded boxes that go inside, so there's no confusion and no possibility for mistakes. And we use the same optical modules whether or not you're reading from a top read or from a bottom read assay. So it's suitable for both cell-based approaches, and some of the TR-FRET applications can also be read from the bottom, in addition to, and just see the laser pointer here. Here we go. So from the bottom as well, from the top, the cell-based applications. But of course, we're here today really to talk about TR-FRET applications, and we ensure outstanding HRF performance because we have dedicated detectors that are red-shifted and are photon counting. So we can maximize the performance we get from every flash that you use in your HRF or your TR-FRET screens. So again, standard features you would expect from these readers. We are doing Z height, or I would call it Z height, you'd probably call it Z height adjust, from both top and bottom in 0.1 millimeter resolutions. And we have integrated barcode reading for plates on the south, the east, and the west sides, along with stackers, of course, for higher throughput applications. So to round up on the general features of this instrument, we of course offer incubation and shaking for enzymatics. That's obviously quite important to keep a stable temperature. We have 2 integrated reagent injectors, which are an important component for the HRF and kinetic HRF applications that Stephen's using. I'm going to talk a little more on those. And we do offer troubleshooting tools unique to BMG Lab Tech, where maybe you want to look at the decay curves of your TR-FRET applications. These are built into the software that we offer with the Ferrostar system. And this image, so this is to the right, the TR-FRET decay curves for alpha, and here we have high resolution well scan options for very simple or fast reads of cell-based assays. So then to talk a bit more then now, to go into, if you like, the TR-FRET and what makes the Ferrostar good from that perspective. We have 2 different light sources for TR-FRET applications, a flash lamp and also a laser. As you can see from the data that we present on the right-hand side here for both europium and terbium donors, this is produced by Cisbio bioassays. You can see that we can achieve very good Z primes either with reading with the laser or with the flash lamp, okay? But signal to blank can be improved by using the laser where a terbium donor is used. And that's because our laser is slap bang on 337 nanometers. This is the optimal wavelength for terbium. So you can see for some assays you may see an improvement in the signal window by using the laser. The real advantage of using a laser is actually the speed of reading, and Stephen will probably talk about this as being important for the kinetic applications, especially where you have fast on and off rates. We can get a lot more energy through with a laser flash than we can with the flash lamp. So basically, it really facilitates those faster reads. And the other feature that Stephen will probably talk about today is the use of our injection system. So these injectors are built into the side of the unit, so they don't take any extra space. But it's really important, this ability to inject and read simultaneously, basically, for this TR fret application. So again, where we're talking about speed, fast on and off rates, you want to be able to add something, read those wires as quickly as possible to elucidate what's going on. So users can vary volumes and even use volumes as little as 1 microliter. So even in a 384 well format. So to finish up, I'm going to talk a bit with the FSX. So as I said, the FSX and the FS kind of offer very similar opportunities. So FS users are not banned from using this application, but the FSX does offer some additional opportunities. We've improved the sensitivity in all read modes with the FSX compared to the FS. Some 4 times improvements for fluorescence intensity and fluorescence polarization. Some real big impacts on speed of read for things like FP applications. Broader dynamic range for luminescence assays. So for single point screens, highs and lows able to be visibly rectified easier on this system with the Ferrostar FSX. Improved alpha performance, both signal to noise and also sensitivity, and also the introduction of simultaneous dual emission for alpha technology as well. But from the TR fret perspective, and in terms of benefiting the kinetics applications we're talking about here, the biggest change is the TRF laser that we've introduced. So FS users have the laser working at 40 hertz. That's 40 flashes per second. And the new FSX offers a 60 hertz flash laser. So this could help you in 2 ways. If you were just doing endpoint screening of TR fret, in the same time, you could achieve 50% more flashes. So this would be for someone who's happy with their read times, but perhaps want to increase the counts that they see. We're a photon counting device, so every flash is an accumulation of signal. So if you want to increase your signal counts, you can add more flashes. Or if you want to make it faster and you're happy with the performance you're getting, you can basically achieve faster read times. And just to show this kind of graphically, here you see the comparison of the FSS, the FS, the blue line, and the purple line, which is the FSX, just showing that for the number of laser flashes, the plate read times and how that can change. So if you were running with a previous assay that was at 5 minutes, you could then be reducing that to sub 4 minutes in terms of a general switch. That's even without the sensitivity improvements. It's probably possible to even reduce those times. Or if you wanted to achieve more flashes in the same time, that's what the green line is representing on the screen. So that's our 384 well data. And I'll just pass over now to our 56, just to give you an idea of the read time savings that can be achieved. So really, it's about the precision in reading HRF that the Ferrostar is really offering as a real advantage to this kind of kinetic reading. So the laser gives us these ultra-fast read times. Our injectors, the fact that we are the only people able to inject and read simultaneously, again, this contributes to the fast reads and these kinetic applications. And of course, it's applicable on both of our systems. So at this stage, I will pass over to Stephen to discuss more, if you like, the real-life applications for this technology. And thank you very much for your attention.
Well, thank you very much, Catherine, and thanks for the invitation to come and join this workshop. So I'm going to talk about the development of these types of assays, and then I really want to give you a perspective of why we're interested in them in the first point, though. So as Catherine said, I have two jobs. I work as a professor of molecular pharmacology and drug discovery at the University of Nottingham in the UK. And we've also started this spin-out company. So this is a new CRO type company which allows us to interface much more easily with industry. And it's one of the routes that we're using to help people develop these assays going forward from industrial companies. So I've been, yeah, that's working. So I've been interested in kinetics for a long time, and I thought it'd be useful to explain why I got into it and some of the utility actually in a drug discovery program. So a lot of people will be aware of the stories around developing compounds with slow dissociation rate to improve clinical duration of action. And the idea is that if you have a very slow off rate from your target, then it can prolong your pharmacodynamic effect, even sometimes when the drug is washed away from the system, and it prolongs that. Now, this is an idea that has a number of different origins. I was particularly interested in respiratory diseases, and these are inhaled muscarinic receptor antagonists. And this one here, ipratropium, was really like a second generation inhaled compound. That was given 4 times a day. But then when tiotropium came along, that only needed once daily dosing, it wasn't clear to the people at Boehringer Ingelheim at the time why that was. But when they radiolabeled both of these compounds and they did receptor kinetic studies using radiolabeled material, they discovered that tiotropium had a much, much slower dissociation rate from the receptor, and they hypothesized that that was what was giving it a longer duration of action in the lung. Now, I think that actually in reality, there are limited situations where this works because your off rate has to be slower than your PK. So you have to have incredibly slow dissociation rates, but certainly there are good examples where it can improve duration of action. I think probably from my perspective, what's more interesting is that it can change the efficacy of your compound as well. And that's particularly important where you have a rapid signaling event physiologically. So if you consider these molecules, these are muscarinic antagonists, and in the airways, acetylcholine is released to constrict the airways, and it does that in a synaptic release, and it's very, very rapid acetylcholine into the synapse and a calcium response. So it's very quick. Now, if in that time your antagonist hasn't dissociated from the receptor, you can essentially get what looks like irreversible or non-competitive antagonism. So you have a more effective block. And that's shown here with this compound here. This is a Novartis slow off rate, relatively slow off rate compound. And you can see in an animal model of bronchoconstriction now. So this is a rat. This compound has been dosed at different doses via the IT route directly into the lung. And you can see here a concentration response curve to methacholine injected IV, and this is bronchoconstriction. So you can see you can get a nice bronchoconstriction. Now this is a competitive ligand, and normally what you'd expect is if you increase the amount of agonist, that with increasing concentrations of antagonist, you'd get a shift to the right. You wouldn't get any reduction in the top, the maximal effect. But this compound is acting essentially as a pseudo-irreversible ligand in this very short time frame, and so you can basically block the whole of this bronchoconstriction, even at incredibly high levels of agonist. So this can be really useful in situations where you have a lot of ligand generated in a system and you want to completely block them off. So I think that's something that's going to become more and more important, and doing really good PK/PD of signaling pathways is what's going to help us understand this better. But the other component, I think, as well as that as an antagonist, is looking at cell signaling as well. So we know that when we're measuring cell signaling to receptor agonists, we can measure it at all sorts of different time frames. So you can look at conformational changes to protein, you can look at calcium signaling in seconds, cyclic AMP within minutes, and then there are various different things like reporter genes or other phenotypic reads that take hours to develop. Now, the problem when we're considering all these different time points is that we need to understand that drugs don't bind instantly. And you can add a drug to a system, and it takes a while to achieve its equilibrium. Now, if the problem is that you don't know where on this equilibrium time point you are with each individual agonist, if you don't understand the kinetics. So what we might be doing is comparing a response here at a very short time point and seeing really low occupancy. But over here, we're seeing high occupancy, and that's going to shift our pharmacology and maybe mislead us. And here's an example, again, this is a Novartis beta-2 adrenoceptor agonist. We call it C26, there's some papers down here. And this has a phenomenally slow off rate for an agonist. You can see these are all the standard inhaled bronchodilators. This one has a very slow dissociation. And the interesting thing is that when you look functionally, either at cyclic AMP, arrestin, or internalization, you see this delay. So this is C26 here compared to isoprenaline and adrenaline. It's delayed, but actually it overtakes them and then has a more prolonged effect. So in each case, it's slower to get going, but has a bigger effect at the end. So the question you have to ask yourself is, depending on where you choose to read your assay out, you can either you could call this ligand here a partial agonist at early time points, or a superagonist at late time points. So understanding the kinetics of agonists and how that pertains to the signaling pathway that you're measuring is also really important when you're ascribing pharmacology, and particularly when you're thinking about bias between different pathways for GPCR ligands. And here's the next one is a really good example of that. So this is a paper that we published in conjunction with the group in MIPS, in Monash in Melbourne. And again, this is now dopamine D2 receptor agonists. Most of the agonists we tested had fairly rapid dissociation rates, but this is the occupancy rate of bifepranox here, very, very slowly equilibrating agonist. If you look at a functional readout, this was cellular impedance, of ropinirole, which is this compound here, a fast compound, versus bifepranox. You see, if you do this at increasing times, that ropinirole actually gets less potent with time. And that's, we think, because ropinirole has a very instantaneous effect and then starts desensitizing the receptor. But if you look at bifepranox over time, it starts over here. I think I'm running out of battery. It starts over here and then gets more and more potent the longer you leave it. And that's because it's slowly reaching equilibrium. Now, if you use one of Arthur Christopoulos and Terry Kanakin's web of bias here, then you'll see that, have you got the other pointer? This one's running down. Oh, it's a bit temperamental. I'll use two. You can see that if you compare different pathways, this is to ropinirole is the standard ligand. If you look at a 5-minute time point, bifepranox looks, in fact you can see it on this kind here, bifepranox looks like it's biased towards G protein. But if you leave it for longer, it then becomes more like a phospho-ERK bias ligand. So depending on when you read out, if you've got slow ligands, you can actually get apparent bias. It's not true bias in the sense that it's actually, they're stabilizing different receptor conformations. It's just that they're doing over different time frames. So to understand agonist bias, signaling bias, I think it's really important to also be aware of the receptor, the binding kinetics to your agonist and whereabouts you're measuring that as well. So my perspective, my opinion is that it's really important to measure it in drug discovery programs. But the problem is that these kinetics assays for GPCRs and other membrane-bound proteins are difficult. Traditionally, these things have been done using radioligand binding assays. You have to radiolabel the material of interest, so that's not useful in a lead optimization program. We've utilized, with radioligand binding, competition association assays, which can be useful. So here you incubate, you follow the binding of your tracer in the presence of different concentrations of your competitor, and from that you can derive your on-and-off rate, and I'll show you how we do that later. But still not very high throughput. And then you've got other techniques like SPR, which have more resolution and can be more useful to look at kinetics, but really still for membrane proteins, they're really restricted to people who are able to make thermostabilized receptors, essentially, because otherwise you can't really get enough of these loaded on, and they're not stable when you isolate them. So really, when we started this program off, what we wanted to do is generate a newer, higher throughput assay to look at GPCR kinetics. We clearly needed it to be 384 well compatible at least. And this is the important thing. We wanted the receptors in their native lipid environment, in the cells which they're normally expressed in, if possible. And to potentially be able to do that in whole cells. So we wanted to take away that whole requirement for purifying and isolating receptors. We needed continuous read of the bound ligand, so we needed rapid read times. Online addition was important, and temperature control is critical as well, because temperature can affect the observed kinetics enormously. And so those were really the types of the system that we wanted to develop. Now, the combination of systems that we used in terms of assay and reagent and then reader were the Sysbio Taglite system, and as Catherine's already mentioned, the BMG Ferrostar FS. We started with the FS, we actually have an FSX now in the lab as well. Now, the Sysbio system is really good. It starts off with a labeled receptor, so you have a terbium label on your receptor. You most commonly use the snap tag system. Then you have a fluorescently labeled ligand, a tracer ligand, and when these bind, you can get time-resolved FRET. Now, if you incubate in the presence of a competitor, then you can obviously see reduction in that signal as well. So that's how that assay system works. Homogeneous and very rapid to respond, instantaneous response. I won't talk too much about the ferrous dye. You've already heard that described in a lot of detail, but it was clearly our machine of choice when we set this up. Now, the system we use is essentially this very simplistic mathematical model here. So this is what you'd be used to seeing. This is the law of mass action. The ligand binds to a receptor with an association and a dissociation rate. Now, if we introduce an unlabeled competitor, we can perturb this binding of this ligand to this receptor. And if we measure this binding here, we can actually derive the on and off rate for our competitor compound using these equations here, which were first described by Matolsky and Mahan in 1984. And this has been now widely used. In fact, these equations have been put into GraphPad Prism, so they're quite straightforward to use yourself if you want to. And the type of data we're looking at it here, we have our fluorescent ligand binding by itself, and then we have a variety of different competitor ligands. You can see these ones have rapid dissociation, and then if you see this type of trace here, so it hasn't reproduced very well on this slide, where it goes up and comes back down again, that's indicative of a slower dissociating competitor. But essentially what we do is we directly fit this curve with the competitor curves using these equations, and then we can get an on and off rate. So the first thing we have to do is profile our tracer. So what we see here is the addition of a fluorescently labeled propranolol at the beta-2 receptor, and we can watch, you can barely see these dots, it's very small I'm afraid, but you can see the dots here, this is our fit through it as it watch associate, and then we put a high concentration of unlabeled ligand in, and we can watch the dissociation rate there. And here's the association of propranolol at 4 different concentrations. Now, the key thing here is that we can get this information from a single well because we're doing this continuous read. So we add and we instantly start reading. So each one of these is a single well on a 3 or 4 well plate. And you can see whether you do it directly measuring or with the off rate here, or if you directly fit these data and to generate the off rate, they're very similar. If we then move to adding a competitor in, you get a slightly different profile. So here we have our tracer ligand by itself, and this is now the association of our fluorescent propranolol in the presence of increasing concentrations of another beta-2 ligand, salbutamol. And you can see that you see a reduction of an effect, and these are all fitted globally to that equation I showed you, and we can generate on and off rates using the system here. And that really is the equivalent when we run this using a radiolabel tracer. Now the key thing here when we're comparing is that for the radiolabel, obviously we have to run different plates at different time points, so it's complicated. We've got to use filtration as well. So we've got fewer time points and less resolution on these curves. But essentially, when we do either the radiolabel ligand or the TR fret, we get basically the same data across a range of different compounds, and they fit well. The really important thing to us, and it's the critical thing which makes this worthwhile, is that although the data are the same, each point for every replica, every n for the experiment here, showing all these data, require 25 wells in this new HTRF assay of a 384 well plate, and they required 768 wells in a standard radioligand binding assay, which is the old way we used to do this. So you can see the magnitude of increase of throughput here. And so this now enables proper screening to be done. Now, when we were looking at this, we were trying to understand which concentrations of ligand would be best for this. And so we had this whole family of curves, but we started just fitting single curves in conjunction with this one here. So if we fit all of these data globally to the equation, these are the off rate, the on rate, and our equilibrium dissociation constant. And this is the Ki. This is derived from the point at which each of these reaches equilibrium. You can do a standard IC50 curve and then use a Chern-Prosov correction to calculate the Ki. What we did then is we actually compared the fit to just these two data sets here. So in the absence and in the presence of the lowest concentration of salbutamol here, which essentially represents about a 20%, slightly less than a 20% reduction in your IC50 curve. Now, no one would ever dream of fitting that on an IC50 curve if you had screening data, but we fitted these, and because we've got the whole of those data set and we've got much more improved statistical fit there, when we looked at the calculated on and off rate from this, they're not identical, but certainly the equilibrium dissociation constant you get at the end of that is really accurate. So what we're suggesting here is that you only need a small amount of suppression of your fluorescent ligand binding to be able to calculate a KD, and maybe an estimate of your on and off rate as well. So this then makes it applicable to low affinity compounds or potentially even fragments. Now, around this time, we were using these dopamine kinetic assays, and this is a paper that we've just published in Nature Communications, which we're really excited about. So we looked at as many clinically utilized antipsychotics as we could, and we looked at them in these assays again, and we found an association with their on rate at the dopamine receptor and the tendency to cause the extrapyramidal side effects that is common to all of these compounds. I'm not going to go into this, but basically what I wanted to say is that piqued our interest at looking at kinetics of new compounds at the dopamine D2 receptor to see if we could identify compounds that have the exact sweet spot to have an effect, an antipsychotic effect, but to avoid these EPS side effects. So we looked at the dopamine D2 receptor, and here is some data here. So this again is a single point. So every one of these is 1 point, and you can see the kind of like the resolution and the reproducibility of the data we're getting here. These curves fit beautifully. And this line here, we have 2 different sets of 5 different compounds. So on the x-axis here, we have the KD calculated from fitting all of these concentrations. So that's a pretty accurate fit. And then what we did is we did exactly the same calculation. We fit the equation, but only to these 2 points here. So that in the absence of the presence of fluorophore alone, and then the presence of the competitor compound as well, but the lowest concentration. And if we did that, and each one of those was less than 25% inhibition, we could accurately predict really nicely. And these are the areas over 4 separate experiments. So this really gave us confidence that we could look at very small changes in inhibition, but still generate a KD value from this. And as I said, it looks to us that it was useful for fragment screening. The problem with fragment screening is that fragments are going to have a very fast association rate. So this is another paper that we published. This is the one I mentioned before, the bias paper with the people at Monash. And part of this was identifying an issue with trying to measure the kinetics of very rapidly dissociating competitors with a slowly dissociating tracer. And essentially, you lose sensitivity when you do that, and you can't really accurately ascribe off rates. So what we did is we wanted to find the limits of this system. So rather than taking 10 different tracers and looking at lots of different competitors with different ligands, we took the easy route and we did simulations. We used Monte Carlo simulations to generate experimental data sets with an added degree of error. So using these Monte Carlo simulations, we wanted to test a variety of different experimental designs to really try and pinpoint the best setup for our fragment screen that we then wanted to run. So what we did first of all, we looked at lots of different tracers. Well, say lots, I think there were 5 different tracers with different kinetics. So from very, very rapid dissociating tracers down to very high affinity tracers. We then looked at the read frequency. Now, Catherine was saying that the ferrostyle allows us to take very, very fast reads. So we wanted to see that if a read frequency of every second, whether that was necessary, or could we actually take them every minute, for example, for slower ligands? And where was the point at which we lost accuracy there? And then another key issue is online injection. Now, obviously, if you add your reagents offline for a plate-to-plate transfer system, you're taking it over to the reader, putting it into the tray, and it has to go in and equilibrate and set itself up. You're missing the first 30 seconds. So we did these either with the first second, so we add and read, or we left a 30-second delay to see how that affected the ability of this the assay to calculate off rates. We ran 200 simulations, and then each one of those simulations was fit independently with the Minkowski-Mahan equation, just like we would do with normal experimental data. And these are some of the types of data sets. Now, we only put one standard deviation error in here, which people say to us is really low. Maybe it was a little bit too low, but you saw the quality of the data that I showed you previously with ropinirole. It's a really accurate assay, really tight. So we didn't want to make it too noisy here because it wouldn't give us the right answer at the end. Now, this is really the nuts and bolts of the data set, and these are very complicated slides. So I'll talk you through them carefully, but I'll just jump to the key points here. What we have are 3D plots, and we've got a lot of information here. So essentially, this here is the accuracy of our calculation of our off rate. So if it's down here, it's a log accuracy of 1, and it's absolutely perfect estimation of the off rate. If it's up here, then we're tenfold out or further, and it's garbage. What we have along this axis here is a range of different competitor off rates, so ranging from really fast off rate competitors like fragments all the way down to high affinity slow off rate ligands that you might get in, at the end of a lead optimization program. We then have read frequency on this one, so we're going from very fast read frequencies to very slow read frequencies. And then from that we can plot all of these different parameters and see which ones give us the most accurate effect. Now you'll see a lot of red here because the red is our fourth dimension, and that's the coefficient of variation. And you can see when you have red, really high errors on those 200 estimates. It's nonsense basically when you get red. So this is what it looks like for 4 different tracer ligands with different off rates going from fast to slow. But the key bit here, this is if you leave a 30-second delay. So if you don't have online addition, this is what you get. You can calculate the off rates for slowly dissociating ligands, but if you have ones that dissociate rapidly, then you can't measure them at all because it's all over and done with by the time you actually get the thing in the plate reader. If we look at the story when we have online addition, it's very different. So here we have for example, a slow tracer ligand. Now we still have this problem here because this ligand doesn't equilibrate fast enough. But if we use a rapidly dissociating ligand here with a K-off of 10 per minute, you can see that this whole surface lies flat. So every estimate we had was very accurate, and you can see there's almost no error in the estimates as well. So if we can hit that first time point at 1 second with the online addition, and we have a rapid tracer, we can essentially define the kinetics of compounds with incredibly fast dissociation rates, like fragments. So key bit here, really, the take-home message is that you have to have a fast tracer for rapidly dissociating ligands, and you have to have an early read time. You must have this online injection if you're going to start doing low affinity fragment type screens.
Question. Does the on-rate tracer matter?
The on-rate defines how much you have to put in, essentially. So you can change that a little bit just by putting a little bit more of your tracer in to speed that reaction up. But the off-rate is the critical thing that we found. I'm going to skip through this because I'm probably running short on time, but we wanted to check which concentration of fragment we should be testing. And of course, you can either test at 10 or 100 or even 300 if you've got soluble ligands. And what we found that depending on where you tested them, and this is modeling in, again, simulations, input versus output, you start to get error at either end if you use just one concentration. So what we decided to do is use 2 concentrations of each fragment. And that allowed us to get really nice, consistent estimates with very little error of our data. So at least one of those concentrations should be within the point where we can get some inhibition of our fluorophore testing. So this is essentially how we set this assay up. We had 2 concentrations, we had online addition, and we needed to find a rapid tracer. And so we tried 3 different tracers, and to cut a long story short, spiperone here, which is the one that most people will use. It's a nice high affinity ligand, really good ligand at the D2 receptor, was far too slow, very high affinity, and not appropriate to do this type of fragment screening. So what we utilised is a ligand that again that Cisbio had synthesised and kindly donated to us. It's a fluorescent PPHT derivative, and this one, along with a fluorescent clozapine, the 2 of them had much more appropriate tracer kinetics. So they had much faster off rates than spiperone. So we went with PPHT to do this particular experiment. The library we used was from a company called Celsia. There's around 1,400 compounds. I won't go through all of this. You can see this on their website, and you can actually get this library via this BioSense compound cloud if you're interested. If you want that detail, because I'm going to switch through it now, then come to me afterwards and I'll give it to you. So this is essentially the flow that we did. So we started off with our plates. We plated them at 2 different concentrations, 10 and 100 micromolar we chose. We do this using the TTP LabTech Mosquito, which is very, very quick and allows us to do nanometer dispensing in DMSO, which is fantastic. We then, before we put the membranes in and built the assay, we looked at we just added the tracer in with the compound. and then we read at the tracer emission. The reason we did that is because we wanted to check whether the fragments were quenching the tracer itself. So this is an important control you need when you're interpreting the data, and you need to do it before you put the membrane in, otherwise you can't really interpret it very easily. We then, using the injectors that Catherine mentioned to get this online addition, we add the membranes and immediately start reading. And from that, we then we excite our terbium emission, and we're looking at TR fret now across to our tracer, and we can get the fret from the 665, but we also collect from the terbium reader as well, because we want to understand whether the fragments are quenching the terbium, because these are the two things that could be interfering. And then finally, we looked at a type, slightly out of order, not sure why we name them like this, but this is historically how we did it. The type 2 kind of like false positive was where the fragments quenched the tracer once we'd finished the assay. So we did a final read right at the end of our experiment. Now, basic stats, we tested 1,366 fragments. We got a reasonably high hit rate initially of 16%. When we went back and we looked at in all of these types of false positive effects, we identified that 70 of those were affecting the fluorescence of either the tracer or the terbium itself. So we had some false positives there. But it was fairly effective, and I'll just go quickly through what we found there. So these are the type of data that we were generating. So these are now very low affinity fragments, and you can see we found some that gave us a nice inhibition of our fluorescence and fit really well. And some of them where only the 100 micromolar were effective. The type of molecules we picked out were really reassuring. So this is dopamine. You'd hope that you might find ligands like this, and sure enough, we found catechol compounds with a similar amine here with dopamine, so those were pulled out. We also found fragments like this, which again was reassuring, because if you look at these ones, you can actually almost build spiperon back off of this. So in this fragment library, they've obviously taken commercial marketed clinical compounds and split them up into different parts, and we identified both of the parts more or less. It's not quite the same as the head group of spiperon there, but certainly we could find compounds that clearly were known pharmacophores at D2. We also found a whole series of these phenol pyrazines, loads of them in there. And again, that was reassuring, because if you look at a number of other different D2 ligands, this happens to be a common motif in quite a few of them. So we were pulling out compounds that made a lot of sense in terms of the pharmacology of the dopamine D2 receptor that was known. So we think the ones that we pulled out of hits certainly were positive, real positives. So just to try and break down the false positives as we finish the talk now. Type 1, remember, so this is the one that reduced the tracer fluorescence. And we eliminated anything that reduced it by 3 standard deviations. Now the error on this was tiny, so 3 standard deviations is still not much inhibition, you can see here, but we eliminated something that was a bit like this. So we had some of them here. What was really interesting, we still find this puzzling, and if anyone has any ideas, please talk to me at the end or through questions, is that we had quite a number of compounds that actually reduced the tracer. So now we're still exciting at 620 and looking at 660. So this is not using terbium and frets, it's just looking at the tracer. After we put membranes in, we had some fragments that quenched that tracer fluorescence, where they didn't in the absence of membranes. And you can see these are the type of kinetic profiles that we're seeing of those compounds. Now this could be potentially because the membrane itself is acting as a bit of a sink, and it's bringing those molecules closer together, so you're getting a more proximity type quench. But we haven't really got to the bottom of that yet, so we need to follow that up. And then we had only a fair few compounds, and there's some overlap here, that actually reduce the terbium. So here we're looking at terbium emission. It's fine up until you go to 100 micromolar, and then you see it completely takes out the terbium signal here. And that's what it looks like in the fret. So these are the types of false positives that we're seeing. But as I hope you've seen, the way we set our assay up, we were able to detect all of these and bin them very, very simply, just from the first one. We didn't have to go back and retest these and try and find out whether they're false positives. We could get all the information from the first screen. Now, just to really summarize what we found, we had a range of hits I showed you already. What was really interesting is, though, we had a kind of a range of about 1.5 orders of magnitude in our K-offs that we found for these fragments. And this was really independent of their overall equilibrium KD. So you can see you can have compounds here with KD of 100 micromolar essentially, but you can have ranging from fairly slow dissociation up to very rapid dissociation. So it doesn't, off-rate doesn't, for this compound set, does not go hand in hand with equilibrium affinity, which I think is a really important message because most people would think that would be the case. What we see, and we've seen this for a number of different GPCRs now, is that actually it's the association rate that appears to be more, better correlated to the overall equilibrium KD. And that's exactly what we found in this fragment set as well. So the on rate for these compounds is driving, well, appears to be driving in large part the affinity. And here we've got the classic plot of K on versus K off, and you can see these are the diagonals which give you the equilibrium affinity of these fragments. And you can see that we have a cutoff here where we just simply couldn't measure anymore because of the concentrations of fragments we used. But again, we've got a range of kinetics on those different fragments. So we could potentially go into those fragments and select the scaffolds that might be best for selecting the appropriate kinetics for our clinical So, just to finish off now with a summary of what we're talking about. I genuinely believe that kinetics at all targets, particularly GPCRs because they're harder to do, can have a large impact on the compounds you choose, and particularly, I think, on efficacy and safety. We've been successfully developing these TR threat assays in collaboration with Cisbio for several years now. And we worked out a few different tricks along the way to get this working. And I think that these really are going to be useful going forward. You can see they're more sensitive, you don't need so much inhibition. And my opinion is they're going to essentially replace IC50 assays. You don't need IC50s anymore. You can get the data from a single point of concentration. You can get low affinity kinetics. I've mentioned that already. And we, and because we can look at the full trace, we can identify false positives more easily, so you don't need to do iterative follow-up IC50s. And I guess we're quite excited that we actually found some compounds. I showed you the compounds, the fragments that have dopamine D2-like pharmacology. We found some that were completely new chemotypes, which we'd like to follow up on. So I just really wanted to finish then by thanking everyone who's helped us along the way. This is the University of Nottingham and the new Centre of Membrane Proteins and Receptors at Nottingham and Birmingham Universities in the UK. And David Sykes did a lot of this early development work, and Jack Lockray is a new student who's taken this over. Obviously, Celsi for the library, Accelerate, Viral Patel, along with Joby, did all the liquid handling, and then, of course, the guys from BMG and Cisbio who really supported us all the way through this. So if you have any questions, I have 2 email addresses. You can choose whether you're an academic or whether you're an industry person, which one you want to contact me on. But I'd be really happy to hear what you think about this type of approach and answer any questions now. Thanks very much.
We started a little late, so we're running close to time, but does anybody have any questions for Stephen right now?
Are your labels on cells that are overexpressing this, or are they cells that are natively expressing the dopamine receptor?
So you have to. These are recombinant systems. So the receptor itself, it has a tag, a SNAP tag on it. So you have to express that.
Is it a peptide tag?
It's essentially a small peptide, small protein actually, the SNAP tag. But it's essentially irreversible once it's on there. So it's a very high affinity interaction, and it stays labeled for a long time. But yeah, you can actually, because this is a really sensitive system, and because it's time resolved, you can get away with a lot of the autofluorescence. You can get away with actually very low receptor expression. So you don't have to have masses of receptor in there to get a good signal.